On 6th April 2022, public health officers around the country went on a sit-down strike as a result of disenfranchised treatment and lack of government payment on called specialty, risk, and responsibility allowances promised. A recent press conference was summoned by the executive to communicate that the first phase of the strike will be called off. The association wishes to make this clear that threats to any member of the association will not be taken lightly. All officials are urged to desist from threatening or victimizing any member of the association.
I am Jibril Gandobalde. I'm the IPRO of the Association of Gambia Public Health Officers. And we are here today gathered on this press briefing to give you, especially the media and the general public at large, our status as far as the sit-down strike is concerned by the public health officers in the Gambia. So, but before getting into the program proper, I'm here, joined by my able executive of the Gambia Association of Public Health Officers, and I would like them to introduce themselves to you, the media, our colleagues who are here with us, and everybody who will be watching this program. From our executive and our able president, Mr. Noha, is on his way, and soon he will join us before the end of this press briefing. So just to say a little about why we are gathered here today as the PRO before handing over the statement of the association to the Vice President, who will be reading our position statement. We are here gathered today because we have been promised since last month, as we all know, in May, we made a strike in April. That was 6, and then the strike was called off due to an agreement, a gentleman agreement, and also a written agreement, both agreements. And then we called off the strike, and they promised, when we called off the strike in April, end of April, yes, we will not be able to get paid because it was way beyond the time that will be allowed for payment to be disbursed. But we were promised, come May, end of May, all the allowances that we are claiming will be paid to the public health officers, and which did not happen. Because the allowances we are claiming for is very important for people to know that these are allowances that have been given to our colleagues in the Ministry of Health, though different cadres like nurses and doctors. And these allowances are responsibility allowances, on-call allowances, and special skill allowances, and risk allowance. So all these 4 allowances, we feel every staff of the Ministry of Health is entitled to. There is nobody who is taking more risks when it comes to risk allowance than a public health officer. Because when there is cause for any disease that is having a potential to cause an outbreak in the country, the public health officers are in the forefront of that intervention. When there is dead cases of decomposing bodies, which a doctor will not be sent to or a nurse, it's a public health officer who will go to investigate that death, whether it is at sea or whether it happened in a house 4 or 5 days ago or what. Our colleagues are here. After, you can ask them, and then they will tell you their experiences with these kind of situations. So when it comes to responsibility allowances, nurses are given responsibilities. Public health officers also are given responsibilities, whether they are desk officers, whether they are managers, whether they are directors. So we all have responsibilities. And when it comes to the special skill allowances, we also have our skill in different areas. So these are the allowances that we are claiming for, and on-call allowances. For example, I might close at 4 and 8 o'clock in the night. I might be called by my boss to make sure that I have to go and intervene or attend a special program. So these are all on-call allowances that nurses are benefiting, doctors are benefiting within the Ministry of Health, that public health officers are not benefiting. So we are not asking for allowances for the COVID or allowances for otherwise, but the same allowances that have been given to our colleagues within the same Ministry of Health is what we are asking for, and the promise that was made for allowances to be paid in May was not respected, was not honored, and then we had an agreement before that if the agreement was not honored, we are going back to the sit-down strike. And that is what is unfolding. So I thank you all for your timely coming for this very important press briefing. So without delaying much time, I will just let my Vice President go into the statement that we came up with as our position as far as the association is concerned. So I thank you all for your kind attention.
Good afternoon to you all. The Association of Public and Environmental Officers of the Gambia, established in 1971, is a registered non-profitable organization serving the interests of public health professionals in the country. Its main objective is to enable public health officers to deliver quality service to the Gambian people. The diverse membership of the association served and continues to serve in various capacities in the ministry, parastatals, NGOs, UN agencies, and beyond. On April 6, 2022, public health officers around the country went on a sit-down strike as the result of what? The enfranchised treatment and lack of government payment of on-call, specialty, risk, and responsibility allowances as promised. The industrial action by the public officers led to the call of an urgent Congress, where members converged and discussed extensively on the matter. In the interim, the association executive had a meeting with the former Secretary General and Head of Civil Service, who promised in writing to make sure the allowances are paid by end of May 2022. Again, a press conference was summoned by the executive to communicate that the first phase of the strike will be called off awaiting the end of May 2020. As per the Congress resolutions, the executive body was tasked to work with the Human Resource Director and Director of Public Health Services to update the list of eligible members to benefit from the allowance. The executive was also expected to follow up with the Secretary General and other appropriate agencies responsible for making allowance payment happen. The association leadership, for its part, has provided an updated list through the Director of Public Health and Director of Human Resources. The executive tried to contact the former SG by phone with the aim of discussing the progress of the situation, but the outcome was unsatisfactory. Following the cabinet change, the executive wrote to the current SG on May 17, 2022 to request a meeting to discuss the allowance status. Still, after repeated follow-ups, we received no response. The executive again wrote to the Secretary General on May 25, 2022 to remind her and her valuable office of the April 22 agreement written between her office and the organization. The following individuals were copied in the letter described above: Minister of Health, Office of the PMO, Permanent Secretary, Minister of Health, Registrar Public Health Council, Director of Public Health Services, Director of Human Resources, and Director of Finance, Minister of Health. Up to date, the executive has not received any form of official feedback or allowance payment from the letters written to the authorities concerned. Currently, in the country, the number of clinics cancelled is about 124, which has given almost 100 kids in the Gambia missing their 100,000 children in the Gambia missing their vaccination. No surveillance activity, no bar registration, no participatory health and hygiene education in the community. Suspected cases of outbreaks: measles, currently we have 11 suspects. Monkeypox, we have 2 suspects. AFP, polio, we have 1 suspect. Rabies, we have 1 case. And in the viral hemorrhagic fever, we have 2 cases have not been followed up or investigated because the public health officers are on strike. As a result, the entire membership of the association was left with no choice but to lay down their tools until further notice. The second phase of the sit-down strike started on 4th June 2022. During this period, all essential public services are put to standstill. Such activities will include and not limited to all active and passive disease surveillance activity in the country, surveillance at the airport, seaport, and all the border crossing points, immunization activities, birth and death registration across the country, health education and promotion activities in all media outlets and communities, all COVID-19 related activities. The association wishes to make this clear that threats to any member of the association will not be taken lightly. All officials are urged to desist from threatening or victimizing any member of the association. To end with, we would like to remind the general public that the primary aim of all public officers across the country is to deliver quality health services to the people of the Gambia, and that is evident in all services the officers have rendered and continue to render to the general population. On that note, we seek the indulgence of the general public and all our service recipients and reiterate that we deeply regret any interruption of service as a result of the sit-down strike. Thank you very much from the executive of the association.
And we all have heard the statement of the Association of Public Health Officers in the Gambia, and this is our situation as we speak. We have tried series of times to engage the authorities, and just last week we were up to the State House told that we are to meet the Secretary General at 10 a.m. and it was rescheduled for 3 p.m. We waited till 3 p.m. and then we were later told that we cannot have the meeting with the Secretary General because he is having another meeting on the same issue but with other stakeholders like the Permanent Secretary for Finance, Permanent Secretary for Ministry of Health, the Director of Public Health. So we have tried all means just to make sure that we don't get to this level. That's why since last week, we started this strike on the 4th of this month, June, but we didn't go public to the media with the anticipation that before Friday, that was yesterday, they would have done something and then we will resume work by Monday. But that has not been done, and the promises that we were given are not fulfilled or respected. So we feel that as a cadre, we are not taken seriously. We feel that as a professional cadre, we are not respected within our own Ministry of Health. And we also feel that as a professional cadre, we are not given our due that is due to us, as the saying goes, because nobody is taking more risks than a public health officer. I don't see no nurse or doctor taking the risks that we take. Because if there is any sign of any new disease outbreak coming into this country, the doctors and nurses will be behind the public health officers who will be leading that responsibility. So without wasting most of your very valuable time, we will like to open the floor to the media and anybody who is here who have a question, so that the executive, we are now fully represented with the arrival of our president, Mr. Nuha. Can I have a round of applause for our president, please? Mr. President, you are highly welcome. Wake up now, you have been waking up, huh? Yes, so welcome.
We are very much aware of the risk that this sit-down strike can cause, but we are not the only players. I mean, in this whole saga, we are just a component of everything that is happening at the moment. As far as we are concerned, we are doing everything humanly possible to make sure this situation becomes history. And it is left to the other stakeholders to also do their part. And we believe if they also know the consequences, I mean, the risk attached to this particular saga, they would have acted by now. So as far as we as public officers are concerned, we are very much aware of the risk that is at stake, and we are doing everything possible to make sure it didn't reach that level. But I mean, it is left now with the other stakeholders too to also play their part. As far as we are concerned, we are doing everything we can do. Yes.
To end with, they would like to remind the general public that the primary aim of all public health officers across the country is to deliver quality health care services to the people of the Gambia.